Everyone, this is Casey, and today we're with Dr. Love and Brandy and Clara, and they're actively injecting platelet-rich plasma into his scalp. So Dr. Love, tell us a little bit about PRP and what it does.
Okay, so PRP is a growth serum, basically. The platelets have 5 different growth factors that they release that stimulate rejuvenation of tissue, particularly skin and hair. So we're doing it today to rejuvenate scalp. I think the applications for scalp include both genders and all ages. We're going to use it on somebody my age and both genders to do a total scalp rejuvenation and enhance their hair quality. Very similar to if you're having a facial or some kind of laser resurfacing to make your facial skin and wrinkles look better. It also has a role in younger patients, particularly males, where we're trying to stave off their early male pattern hair loss to try to prevent their testosterone-driven hair thinning. So it's really a good technology.
Talk a little bit about our system. I know you did a lot of research into our ProGen system, so why did you choose that one?
Good question. So Casey and I got really interested in this about a year ago. There's a lot of circumstantial reports, not circumstantial, kind of incidental reports of people using PRP for different things. But in the last 3 years or so, there's been really 45 or so really good articles kind of taking a bit more scientific approach, looking at the benefits of platelets and quantifying them, and that's what convinced us that there was merit to employing them. Then we researched what system to use. And what we've concluded is, and I think what the data would support, is really the number of platelets is important and also the concentration in which they're delivered. And that's kind of a little bit of a hard thing to get your head around, but the point is the more platelets and the higher concentration they're delivered, the better. And if you look at the systems that are out there, we chose the ProGen Bellis because with our desire to do a whole scalp rejuvenation, we needed a large volume of platelets and high concentration, and this is the system that we thought that we could deliver the highest quality product at the most affordable price for our patients.
So can you do this pre-transplant or post-transplant or both?
Yeah, you know, I think that in the transplant realm, if you've got a male patient that's a great transplant candidate, spend the money on the transplant because we're fixing it permanently. When we have somebody my age that's female that's got some thinning but hasn't progressed the idea that they're going bald or that they would have to resort to something so dramatic as a hair transplant, we can make your hair quality, your density significantly improved without having to, you know, subject you to a more definitive surgical intervention.
Mm-hmm. And a lot of times patients have a question, and the question is this painful? So can you speak to that?
Well, thanks to that sweet lady back there, Clara, she and I, because she's been practicing on me, she's been doing hair transplants for 30 years, her block technique is great. She's numbed up my scalp. The entire scalp is numb. They're injecting me now, and there are 3 basic primary little small needle pricks with a 31 gauge needle, and she's got a great subtle injection technique that's been able to make my scalp numb. There's a lot of different ways different officers are doing it. We practice with the nitrous oxide, but you know, this is really painless, and you got to have quality and you've got to have experience, and that's what you're seeing right here with Brandy and Clara doing my injection.
So if somebody's interested in this, is this maintenance? Or how many treatments do they have to have? What?
Okay, so real good question. So the numbers would suggest that 4 injections done in about a 6-month period of time is the basis of what data has been showing about a 30% volume improvement. Volume of hair would be defined as making your regular or you're going to look at your scalp and say that's one of my normal hairs get slightly bigger around. And then you have other hairs on your scalp that are dying or involuting, and they're called villus hairs. And the data would support those villus hairs actually grow longer again. As they deteriorate, they get shorter and smaller. It actually makes them grow longer and get bigger again. So we're not making new hair grow, but we're making the hair that you have remaining healthier and more vital.
Okay. Well, if anybody is interested in a hair transplant or PRP,
and one other thing.
Yes, sir.
Its applications, if you look at platelets, we've got a lot of other applications, and we're using it to enhance all of our laser and radiofrequency based technologies and our microneedling technologies. And we're coupling them with fat-derived stem cells, which is the future of regenerative medicine. A platelet is not a stem cell. It's completely differentiated. It's doing what it can do, which is it activates your native tissue to get healthier by releasing those 5 growth factors. What we're doing with your stem cells is we're taking out the cells that actually are responsible for your healing. And if you combine the two, you get a boosted effect. So stay tuned, because within the next 3 months or so, you're going to be getting information about combined protocols for fat-derived stem cells and platelet therapy for scalp rejuvenation. The stem cell therapies we've been doing on facial and hand rejuvenation with micro and nanofat are remarkable, and you'll be hearing more about that.
So be sure to like us on Facebook and follow us on Instagram. And if you guys have any questions about hair transplants or PRP, be sure to call us at 751-LOVE.
Like us.